So what are some great tools we can all implement, let's say during an actual panic attack or to help cope with a traumatic event that we may be in the actual moment?
Okay. So panic attacks, those are intense. You immediately, the breath. I know it sounds so simple, but like I mentioned before, nothing can function without the breath. So if you think about it, giving birth, elite sport competition, meditation, yoga, everything is around the breath and emotionally regulating. So start breathing. And it's not, no, I mean, proper breathing is you breathe in from your nose for, let's say, 4 seconds. You hold at the top for a couple of seconds and you exhale with your mouth for 6 seconds. So that's the longest part. You have to catch your breath. If you do this 5 times, 10 times in a row, slowly, it's a slow rhythm. It's like a dance. That's going to immediately help you feel calm, right? But what happens is during a panic attack, and they're so uncomfortable, we need to invoke your senses. So if you can jump in a shower, if you're home, jump in a shower, water, get in the shower and wet your head. Name 5 things in the room. Listen, name 4 sounds that you hear, 3 things that you smell if you can. Try to drink something, eat something, but you want to invoke your senses again. Because why? Because it grounds you. And when you're grounded, it passes. Another thing is, if you've had a panic attack before this one, remind yourself you're going to live. You're going to get through it. It will feel like you're dying. Feels like you're having a heart attack or you're going to go crazy, but you're not. So tell yourself, I've been here before. I can get through this again. And what happens is when the panic attack comes and you're like, oh no, here it is. We're like, no, go away, right? Because it's uncomfortable. If you can somehow train your mind to say, okay, I'm going to release and I'm kind of like loosen up, as difficult as that may be, and like allow it to come in to pass you, because if what you resist persists. So if somehow you can just be like, okay, I know what this is, I'm going to let it pass through me, it won't feel as uncomfortable, right? But it's about breathing. It's about knowing you're going to survive it. It's about your senses. Remember, if you focus on the breath, your brain can only focus on one thing at a time. If you have an animal with you, that's really good too. Like hold your animal, rub your animal. I've been there. I've been there with my dog. Again, why? Tactile. You can't just sit or stand there. If you're sitting, get up, stretch your body. If you're standing, sit down, put your feet on the ground, hold something. Let's say you're in a chair, hold the chair because you need to touch something. So it's your senses. So that's for panic.
Wow, fascinating. So it sounds like all those different tools are really pulling you out of the emotional and mental and really putting you in the present moment, kind of.
Pulling out your mind.
Yeah, so you're kind of activating all your senses and now you're really present.
Exactly. You're completely engaged in that second of whatever you're doing.
Right. Yeah, that's probably, and I loved how you were talking about the self-talk, because I myself had experienced panic attacks after my COVID, pretty soon after I started healing, which I'm a pretty, I mean, you know me well, I'm pretty strong mentally and emotionally. And it was very shocking to me because I've never been out of control, my mind or, you know, mentally or emotionally before. But that's one thing that really helped me, because I would start, you know, trying to do a little exercise here and there, like maybe a couple squats as much as I could. And then when I would start having a panic attack, thinking my lungs would shut down, I would tell myself, well, you just did 3 squats like an hour ago and your lungs were just fine. So your lungs aren't shutting down. You can still breathe, they work. And that would start really kind of bringing me down out of it too. So yeah, that's a powerful tool.
That's fantastic. I'm so glad you feel better. Yeah, we tend to catastrophize. You know, we start thinking from 0 to 100, the absolute worst thing that can happen.
Yes.
But what you did was CBT, really. It's like Do I have proof that this is actually going to happen? Yes or no? Okay. If yes, there's actually evidence that shows I'm going to die right now if I do 2 more squats. What's the evidence? Okay. And if there's evidence, then 2 or 3 quick action steps that you can do if something should happen. But if usually it's no evidence, it's just our mind, so then you need to replace it with another thought. But easier said than done. I mean, we intellectually get it, but when you're experiencing it, it feels like awful.
Yeah, the first couple times I had zero
Now
control.
are you doing like 50 squats?
Took me a minute. No, not yet, but we're getting there.